Finishing breast cancer treatment is a massive milestone, but the transition into survivorship usually requires a long-term strategy. For many, that means a daily medication regimen lasting anywhere from 5 to 10 years. One of the most frequently prescribed medications is tamoxifen, often known by the brand name Nolvadex. Its primary role is to serve as a protective shield against cancer recurrence. Tamoxifen is a selective estrogen receptor modulator. Because breast cancers rely on estrogen, it targets specific tissues. By occupying breast cell receptors, the drug prevents real estrogen from attaching. This blocks the growth signal, starving cancer cells of their fuel source. While this blocking mechanism makes it a necessary defense for the breast, the drug behaves differently once it circulates to other systems in the body. To understand that difference, we have to look past the breast tissue and follow the medication down into the liver and the biliary system. In the liver, the drug's behavior shifts. Instead of blocking estrogen, it acts as an agonist, binding to receptors and mimicking its effects. This creates a unique biological situation where the liver processes a simulated estrogen signal every day for years on end. Over a long-term treatment plan, this continuous mimicry can place significant strain on an organ we rarely think about, the gallbladder. In its normal state, the liver produces bile, a specialized fluid that the body uses to break down and digest dietary fats. Researchers have proposed that simulated estrogen may trigger the liver to dump excess cholesterol into the bile stream. This high cholesterol concentration changes the fluid's consistency, causing the bile to become thick and sluggish as it moves through the system. There is also evidence that the medication may disrupt conjugation, a process involving the amino acids that hold the bile together. To remain stable and soluble, bile relies on specific binders, primarily the amino acids glycine and taurine. If the medication alters these binders, the bile can lose its structural integrity and begin to break down chemically. When dense cholesterol levels rise and the fluid's chemical stability fails, the environment is set for a total biliary breakdown. The physical result of this instability is that the cholesterol-heavy bile can solidify into crystals, which eventually cluster together to form gallstones. This risk appears more pronounced in specific groups: those on therapy over 5 years, patients over 50, or those who are overweight. It's important to note that these are observed associations in the research, not a guaranteed outcome for every patient. You should never stop or alter your cancer treatment, but understanding these biological pathways allows you to monitor your gallbladder health more effectively. Early changes to your bile health are often invisible and generally painless. Monitoring for early signs usually means watching your digestion. Look for persistent bloating or a sudden new sensitivity to rich or fatty foods that you used to tolerate well. If the condition progresses, you may feel discomfort or pressure radiating in the upper right side of your abdomen, particularly after eating. You should also watch for visible signs, such as a shift toward lighter or clay-colored stools, which can indicate an interruption in normal bile flow. If these symptoms emerge, contact your oncology team to discuss an abdominal ultrasound. Proactive screening can turn a hidden issue into a manageable part of your care. For survivors managing these digestive changes, specialized support is available. Medisyn Labs develops dietary supplements specifically for individuals with altered fat digestion. These supplements are delivered via delayed-release capsules, which are designed to bypass stomach acid and open in the intestine, where fat emulsification actually occurs. Their Gallavance original formula contains a specific complex of ox bile extract, L-taurine, and phosphatidylcholine. They also offer Gallavance plant-based, a formula designed for those who require digestive support without animal-derived ingredients. Long-term survivorship is about supporting the whole body. If you're considering a supplement to support your digestion, speak with your oncologist to ensure it fits perfectly into your overall care plan. Note that these statements have not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, cure, or prevent any disease.